Minimally invasive surgical technologies are advancing at the speed of light, and Southwest Washington Medical Center is keeping pace, utilizing the latest surgical tools and working with world-class physicians. Our pioneering spirit is helping to redefine healthcare in Southwest Washington.
The future of surgery, I think, will continue to move towards minimally invasive surgery. I think it's important that we do that as long as we are offering a similar surgery and with similar, if not better, outcomes.
With high-tech robotics and advanced catheter-based technologies, most of Southwest minimally invasive surgical patients experience less pain and have much faster recovery times.
One of the determinant factors in outcomes of patients is not to hurt them during the exposure process. So the advent of the minimally invasive techniques does a great job in treating the problem without being destructive in getting there.
Robbie Rogers had 3 minimally invasive abdominal aortic aneurysm surgeries at Southwest. Recovery time for a minimally invasive AAA is much faster than the 6 to 8 weeks for a traditional AAA surgery.
I went in and it was actually done in the morning, and I was out that night, and I went back to work the very next day. I had to spend one night in the hospital, but I was on my days off, so it wasn't a problem.
Southwest is among a select group of hospitals in the United States to treat AAAs with minimally invasive catheters and a newly designed stent graft. The catheter is run up through the weakened artery, and the stent is carefully put in place to shore things up.
The minimally invasive approach has dramatically changed vascular surgery and indeed vascular surgery training programs, and it has major implications for training residents. And certainly to be a vascular surgeon in this day and age, you really cannot be one unless you embrace these catheter-based technologies.
What's very exciting is that we now have minimally invasive surgery, I like to refer to it on steroids, with the Da Vinci robotic system.
With the Da Vinci, the surgeon performs the procedure while at a console about 15 feet from the patient.
We are now able to have our wristed movements, and we are not limited to operating with rigid instruments. Instead of 2-dimension, we now have 3-dimension in a high-definition field, and it's an all-immersive environment where you really feel as if you are, a couple of inches tall inside of your patient.
This modern technology is amazing. It's like they do on sci-fi.
82-year-old Jennifer Jordan was the first Da Vinci patient at Southwest. Even though she underwent a hysterectomy, she was up and about the next day, joking around with the nursing staff.
The hospital has been very cooperative and thoughtful and taking care of me. Everybody's right there to help me for anything I need, anytime I need it. Of course, I don't need much because I'm doing so well in such a short time.
Southwest is the first hospital in the region to offer CyberKnife, a non-invasive surgical robot that directs a high-energy radiation beam at cancerous tumors with pinpoint accuracy. The procedure is called radiosurgery. Most CyberKnife patients require less treatments than if they had standard radiation therapy, and generally have few, if any, side effects. As surgical technology evolves, so will Southwest. We're committed to staying ahead of the curve so that we can provide the best possible outcomes for our patients.
For this community to have this hospital here is very fortunate. And I think the caliber of the physicians that are coming here are very good. And I think overall Clark County has a very good medical care staff that can take care of them.
For more information about Southwest Washington Medical Center and minimally invasive surgery, log on to our website at swmedicalcenter.org. Southwest Washington Medical Center, pioneering medicine for 150 years and counting.